Hi, this is Glen Pacada from BSN 2C. So in this video, I'll be doing the blood typing. The first one is assessment. Areas or points to be assessed during blood typing. The knowledge of the client about his or her blood type, the client's understanding of the procedure, the client's skin at the puncture site determines if it is intact and if the circulation is compromised. The next one is the planning. Prepare all the equipment needed, such as the OB bag. The equipment, capillary tube, optional. The anti-sera A and B, the reagent that we're going to use. Paper towel. Antiseptic swabs. Disposable gloves. Sterile lancet. It can be either number 19 or number 21 gauge needle. Lancet injector. This one is optional. 2x2 sterile gauze or cotton balls. In this video, I'll be using cotton balls. Clean wooden stick. In this video, I'll be using cotton buds. And lastly, one glass slide. The implementation. Prior to performing procedure, introduce yourself and verify the client's identity. Explain to the client what you're going to do, why is it necessary, and how he or she can participate. Perform hand hygiene and observe other infection control procedure, provide for client's privacy, prepare the equipment, or perform the OB bag technique. Obtain the lancet from the container and place it on a clean, dry paper towel.
Let's go! Right, here we go now. Batman scoop on the mic, mixing the mix on the wheels of steel. This is what I was fucking born to do. Let's go!
Choose a vascular puncture site. Clean the site with antiseptic swab and allow it to dry completely. Put on some gloves.
Let's go!
If used against the site, place the injector and release the needle, thus permitting it to pierce the skin, or prick the site with a lancet or needle using a darting motion. Wipe away the first drop of blood with a cotton ball. Gently squeeze, but do not touch the puncture site until a large drop of blood forms. Place a drop of blood in a glass slide, one on each end. Ask the client to apply pressure to the skin puncture site with a cotton ball or 2x2 sterile gauze. Dispose of the lancet or needle as a unit into appropriate sharp container. A drop of anti-sera A, which is color blue, is added over or near the blood on one side, and anti-sera B, which is color yellow, on the other side of the slide where the second blood is. Mix the blood and antisera using a clean wooden stick. The results are read directly from the slide. The subject is blood group A if agglutination occurred with anti-A test serum, group B if agglutination occurred with anti-B test serum, group AB if agglutination occurred with both test series, and O if there was no agglutination in either case. Place the material used in plastic, sealable, biohazard bag, and transport containers. Remove gloves and perform hand hygiene. Next one is evaluation. Reassess and evaluate the comfort of the client after the nursing care. It is essential to tell the client his or her blood type so when an emergency arises and when transfusing blood requires, they will be able to donate or receive a specific blood component. The next one is the documentation. Document the test and the results from the procedure you conducted.